Hi, this is Dr. Walker. Welcome back to the channel. Today I want to talk a little about some of the things that will likely bother you when you're having symptoms of GERD or reflux disorder. I tell a lot of folks quite often that anything you can put on a pizza can make your reflux symptoms worse. So all the tomatoes, the fried meats, the fried foods in general, the oils, the peppers, the bread, even high carb things, for example, rice, bread, pasta, any of those things can cause you to have your reflux symptoms a whole lot worse. And, I'm not a person that is in accord with the use of proton pump inhibitors like Prilosec and Prevacid. Not because they change the whole dynamics of your gut flora so much, and lots of associated with lots of bad things, which I don't know that a lot of people hear about or talk about. Like there's a recent study that came out that said that people on long-term use or chronic use of PPIs have a 21% increased risk of myocardial infarction. They well-known documented things like problems with wrist fractures and hip fractures. People who have chronic kidney disease, for example, they have a significant increased risk of worsening kidney disorder for those folks. There's always the issue of absorption of your nutrients, your minerals, and so forth. So your calcium, magnesium from your food that you've eaten, all of those things become complicated when you're taking PPIs long term. And one person reported yesterday he's been on a PPI for 40 years. That's 40 years. He's on a PPI, which again, that is in my mind somehow it's criminal. That should never be the case. Especially again, whether you have so many other issues associated with PPIs. Now, the PPI I mentioned before in one of the videos I talked about before, the PPI will increase the acid at the pH of the stomach significantly. So it goes from like a 1.5 or 1.8 thereabouts to like a 6, right? And much of your protein digestion requires a lot of acid, or the pH should be low in order for that to happen adequately. So long-term use again would be associated with things like sarcopenia, or simply that you're not able to absorb the nutrients from your food, making you just worse long-term. And that's not including the bloatedness and the gassiness and the diarrhea, intermittent constipation, diarrhea that people get with long-term use of PPIs. And again, PPIs back in the day used to be that they were used for 6 or 8 weeks or so just to see which of those foods on your list are causing you the problem. And then you would just know that you can't have those things towards the end of the day before going to bed. So ideally, for me, it would be that you create a food diary. What it looks like is you just kind of write down all the things you've eaten during the day, and then really look at how you feel towards the end of the day. Are you having a lot of burn or a lot of things sort of feeling stuck in your chest? If that's the case, then those foods are the things that are going to bother you. And it's different for a lot of us, different for all individuals, I should say. What's making your symptoms worse is different for each person. So, but again, high carb foods, bread, pastas, rice, fried meats, for example, is another thing that will do it. Coffee and teas can sometimes do it. But the important thing is for you to know, create a list for like a week and see exactly what things are making the symptoms worse. And then, not that I'm saying don't have them, but if you do have them earlier in the day. So in other words, your big meal, really, and most people, big meal should be between maybe 2 and 3 in the afternoon. So when you go to bed, your belly is relatively empty, right? So your system is not just focusing on your digestion of your food in your gut, but can also then pays attention to the other parts of your body that actually requires energy or usage of things. So ideally, you want to go to bed with your stomach not too full, because when you do, that makes your reflux symptoms worse. Sleeping, for example, on your right side can also make it worse for you. Obviously, if you go to bed within 3 hours of your large big meal, then symptoms are just going to be bad for you as well. Sleeping in the bed upright can sometimes help some people. But the other big thing I think that helps a lot of folks is just a little baking soda and some water. So maybe a half teaspoon of baking soda with a little bit of water. And you can sip on that after your meal when you're having some symptoms. Sip on that, or people use apple cider vinegar in some water. That tends to help a little bit as well. So those things you can try, as opposed to taking the PPI. And the PPI, just to close the loop on that, they do not stop the reflux. And a lot of people don't realize that. They do not stop the reflux from happening. all that it'll do, it'll make the burn, if you do have burn, it'll make the burn a whole lot easier again, because it's slowing down the acid production in your gut. But the problem with that is that the acid is required for digestion of your food. So when you slow down the acid production in your gut, yes, when you have reflux, it'll be a whole lot easier to tolerate, but know in that your digestion process is going to be significantly hampered long term. And maybe for a couple of weeks that'll be fine, but years on it, 40 years, I can't even imagine the nutritional deficiency that a person would have with that long-term use of PPI. So again, not my thing. Create a food diary for yourself would be number one. The other thing, again, try to, the other thing that I suggested a second ago, like a little bit of apple cider vinegar or some baking soda. Those things can help a lot. And again, they do just the same thing as the PPI, except they do not have the other long-term consequences like 21% increase in myocardial infarction risk. Anyway, thanks for listening, Dr. Walker.